stand out, right? So my name is Dr. Elisa Green. Just FYI, I'm not a physician, but I'm happy to say I'm a nurse practitioner. I got my doctorate degree in William Patterson, and I am a nursing professor in William Patterson. I teach nurse practitioners so that they will be good to you guys, and they will take care of you like in the right way. So I found out that I have a team member here from William Patterson. So
New Jersey Jazz Society.
Yes.
We do our jazz studies at William.
That's really good. So today, my main function is a primary care nurse practitioner. I take care of people like you. And I have a passion to seniors because I grew up with my grandparents and my mom and dad. So whenever there's an opportunity to teach the seniors, I'll say, I'll do it. So I do the same thing to the senior citizens in Jersey City. But I don't go there. I don't like driving. So we do Zoom. And I teach also in different universities for nurses, and I got invited as a speaker, kind of like motivational. I don't know what I motivate, but today I'm going to motivate about how to take care of your bones. So you have your handouts there, so we'll go over it. So what is osteoporosis? Anybody knows? Yeah. All right, because I felt like Margarita and Pat and Atidelia has been pushing you about osteoporosis. So to begin with, how many of you have gone through the bone scan or screening test? So I show. Oh, good, very good. This is great. Because the last time I talked about it, my audience, they never gone through it, and they're like 60 and above. So that's great. It's wonderful that you're taking care of your bones. So it is a condition which the bones become weak, because as we get older, you know what happened, right? Unfortunately, I feel it myself. I was like very bouncy and up and about, and now I have to say to my husband, could you help me get up? And he'll say, what happened to you? I get older. So that's what happened. Normally, our bone become thin, weak, so it could not support the weight that we have. So our job is to take care of it. So as we get older, our bones lose their mineral density. So it has to be dense. The structures become thin, and it is unable to support our weight. That's why we are prone to fractures. The fractures usually happen in your wrist, common on the wrist, hips, that's the worst, and your back, lower back or upper back. So those are the things that these young ladies teach you, is how to take care and make your bones strong. And we have to do it, and we have to be very, very active to take care of it. So how the skeleton changes, you could see this. I put it in color here. So the peak bone mass is between the ages of 10 to 40. You still develop your bones, which is nice. They call it the bone remodeling, every 7 to 10 years. But then after that, you could see at the age of 50, during menopause, it started to decline. So there's a rapid bone building, and at the same time, there's a rapid bone loss. So what are the risk factors for osteoporosis that you cannot change? Age, right? Gender. Female, at the age of 50, they're very prone to or high risk for fractures, sprains, fractures. For men, they're lucky, about 70. They have 20 years. But then, it's also worse when some of my patients, they slip and fall, and they go to rehab. It's very, very hard to recover. Wherein the younger ones, it's quicker to recover because they still develop their bones. They still have the tendency to remodel. We unfortunately, I say we because I'm a senior. I considered myself as a senior. I hide it sometimes. But, you know, sometimes even though we look young, we feel it. I feel it. I felt the changes. I used to have 5 jobs. Now I can only afford 1.5. That's it. So it really changed. So heredity. If your parents, your father, mother, you notice that they're prone to falling and having fractures, you have the tendency to be the same. So your main goal is to prevent it. AIDS, of course, we discuss it. Fracture history, if you're prone to having fractures. Medical conditions, we'll discuss that on the next page, and medications. So the medications that cause bone loss, your anticoagulants, the conditions. So if you have, I don't think any one of these people, beautiful people here are alcoholics, but they are very, very prone to have it because the alcohol affects your bone. They reduce your bone density. So cancers, of course, celiac disease, Crohn's, Cushing disease, diabetes, that's one major thing. Because with diabetes, as your kidneys fail, everything seems to fail. That's why you go on dialysis, unfortunately. Disordered eating, like your obesity because of the weight, they cannot carry the bone. And of course, the malnourished people too. So it goes the same way. Hyperthyroidism for men, hypogonadism, liver, malabsorption, and if you have history of rheumatoid arthritis. The medications that can affect your bones are your anticoagulants. If you have like a heart attack, usually the doctor puts you on anticoagulants like Plavix, heparin, or all those sorts of medications like aspirin. If you have seizure, the dilantin, other inhibitors, chemotherapy, and so forth and so on. And you have that in the handout. I have 30 minutes, so I have to go fast. Because they know, they're aware of the things that you can change. So your calcium consumption. Who among you takes calcium as supplements? Very good. Okay. And vitamin D. Remember during COVID, we were told to take vitamin D, zinc, and vitamin C. And then they also advised to take B12 because that, gives you energy. So if you're smoking, there's still a chance, quit already, or baking. Alcohol, of course. It's okay to take a drink once during dinner, but not, what I mean. It's if you have increased alcohol consumption, like every day you take 6 beers, because one of my patients, when I asked, how many beers do you take? Oh, not so much. I said, so how much is not so much? 3 beers every day. I said, I think that's a lot. And on the weekend, he said, no, on the weekend I just take 5 beers Saturday and Sunday. And I said, what? I said, that's a lot. So, I cannot, because they didn't know that's, how guys are, especially the young one. So, physical activity. So, I'm glad that you have programs that you do your exercises here, because that's very, very important. One of the things that I noticed when people retire, they sit on television, watch, and they never go out. And that's one of the things that I involve my kids, because my kids are involved in sports in Randolph High School. They went on basketball, everything. I tried to make, and I have rules. They cannot do the video game. Because the kids today, they sat and play video games forever. So I have a rule in my house, no video games, weekends only, no television, you go out and play. And until now, they developed that habit. My son is a high school coach in basketball, he is in high school. The other one did very well, is an engineer, and they all are active in their community because I try to foster that being active and doing charity is a good thing. So, posture. I have the tendency, and I know my physician, my primary care. Yes, I'm a primary care, provider, but I still go to the doctor. So she noticed that my posture, sometimes I tend to slouch. Because growing up in the Philippines, we try to hide our, and Ate Delia knows, because we don't want to show the voice. So you have the tendency to do this. So now I have to flaunt it. So I have to straighten my back and show them I have it. While I still have it. So low body weight, of course, if your BMI is below 20, you don't want that. So the normal BMI is, between 21 to 24. 25, you could still get away with it. And the important thing is don't rely on BMI because Asians, we have very low BMI, but because of heredity, all of us are diabetic, we are hypertensive, and we have high cholesterol. So the doctors consider that and said, oh, she's gonna be okay, her BMI is 21. No, if you're Asian, you have to consider that. And we also have high blood sugar because we're used to having our Coca-Cola. That's basically our drink back home.
And you eat too much rice too.
Yeah, oh, you got it. Rice in the morning, all night long. And of course, we discussed the medications. So the most important thing is to get a bone density test. So it's covered by Medicare at age 65 and above, and for men, age 70. But if your primary care physician can say they have history of bone cancer or history of fractures in the family, they have osteoporosis, you can get your density test at a younger age. So that's good. So don't just rely, oh, I'm not 65 yet, I'm not getting it. So I have a couple of density tests because my mother has osteoporosis. So if you justify that, the insurance will pay for it. Anyone younger, as I've said, with risk factor, it is painless. So don't be scared. So who had it? Okay, yeah, so how did it go?
It was fine.
Yeah, you just go in the machine, right?
Right, exactly.
And then think of nice thoughts, and that's it.
It's over in a few minutes.
Yes, so it's nothing to be scared of. For those who haven't had it, it's very simple, and you can actually do it. So isn't it funny that, okay, you had your bone density test, and then the doctor said, you're fine. But don't settle for just you're fine. You have to ask the doctor, what does it mean? Because the things that I teach my patients, I'm not responsible for your health, you are. So that's why when my new patients, they know me. They know I will ask for the medication and I will quiz them, how do you take it? Because most of the times they'll give me these pills, and I said, what are these pills? Oh, you should know. No labels, nothing. So I always advise my patient, have a list of your medication you carry in your wallet, because you never know when an emergency sets and the medical conditions that you have. So now my patients, they know. They have a little booklet that I do. I filled it out for them. I hand it to them, and I said, these are the medications, the dosage, and the time you take it, and these are your history and the reason why you take this medication. So when they go to the specialist, they know me. Oh, you're a patient of Dr. Green. And they said, why? Because you have that notebook. So I give them notebooks, give away notebooks. So they will tell you that, oh, your score is fine, it's so-and-so. So on page 12, you can see this. So you will see that your result is like this. It has a graph. So to simplify it, I did that one. So it's easy to understand. So on the page after that graph, so a T-score below normal in either your spine, hip, wrist, back means you have a low bone density. When you get your bone density test, outsmart your doctor. They say, oh, so you mean to say that I'm fine, and because my result is this. They will be impressed because they know you know better. So the T-score tells your bone compared to a healthy person's bone at a peak bone mass at about age 30. So a score of -1, that's good. It's considered normal. Score between -1 to -2.5, you have a beginning osteopenia or started to have bone loss. And the score of -2.5 or below, your doctor will say, I'm sorry, you have osteoporosis and we have to do something about it. So, how do you prevent it? Everybody knows our mother tells us, go outside and play, get some sun, so you won't have rickets. Way back then, remember rickets?
Oh, yeah.
Yeah, our generation, we remember it because I think I'm the younger portion of your generation, but I'm in your generation. So they say, go drink milk, that's for your calcium. Go outside and play with the neighbors. We are lucky. I considered myself lucky. I came from a very, very poor family, but my mother knows how to take care of the children. I never realized I was poor until we went to my rich relatives. I said, how could they have that?
Yeah.
We never had it. But my mother always said, but you have love from your family and we let you go outside. Look at these kids. They have all their toys. They stay inside. And I realized, she's right. So I considered myself, I still look good, even though I'm a senior. See? So fall prevention. There are certain, my mother-in-law is 92. She lives alone in Florida. And unfortunately, she dropped her soap by taking a shower, slipped and fell, broke her back.
Oh.
Can you imagine breaking your back at the age of 92? I have to deploy my sister-in-law because I couldn't take off from my job and talk to the doctor. So fortunately, she's lucky enough to recover. She's very feisty. Auntie Delia, I think, met her once on one of my parties. At 90, she dances, she goes everywhere. The only medication that she takes, hypertension medicine. And she was very upset because she was diagnosed at the age of 90. I said, I take high blood pressure now. So I said, you're lucky, but you know, so we make sure that she doesn't fall. We develop something that she can hold on the shower and something to, you know, with the footing. So it gets avoided and we have someone check on her.
She lives by herself?
She lives by herself. It's a gated community in Boca. She organized dances with the seniors, the clubhouse. And I'm very, very proud of her because unfortunately my genes are not good. So out of 8 kids, there's only 2 of us left. They died early because we have major medical conditions. That's why I'm very careful. So, if you need supplement, if you don't get 2 to 3 servings of calcium-rich food every day, you may need a supplement. For those who doesn't really, they don't have, or let's say you have a mild osteopenia, they won't prescribe those medications yet, but they'll advise you to take calcium and D3.
Yeah.
So it's a good combo. I think 600 calcium plus D3 plus. You can buy it in Costco and you take that. Citracal and calcium carbonate or caltrate. The body can absorb 500 to 600 milligrams at a time, but do not take it 1,500 milligrams a day. That's too much. What will happen is it will upset your stomach, you'll have GERD, and we have another problem.
What calcium do you like better, the citrate or the carbonate?
Either one is, the citrate I usually tell my patients because they can tolerate it better. Next, so we're on the next page. So load safety. Your spine is very vulnerable, especially when you lift. So you should lift properly. Spread, bend, and do like this. Just, I remember lifting like this, and my husband, what are you doing? You're a nurse. This is when I was new. I said, it's easier. But then I learned that it's wrong. So avoid compression fractures because that's bad. Always bend at the hips with a straight spine. And I know they go over this all the time.
Which one is the compression fracture?
So when you develop fracture, there's different kinds. So it could be open, closed, and compression is when you kind of like compress yourself, then you break your bone. So support the spine bones, practice great posture, good body mechanics, expand your, remember, be proud of it. Always remember that. When you wanna do something, just say, Elisa said, be proud of it. And then you're gonna yeah, you still have it. Be proud. Strengthen your back muscles and then abdomen. You do your abdomen exercises. I see that you guys lift here. Next. I'm almost done. Isn't that wonderful? And we will discuss your medication. So they say stand with a W, like straight like this, but I have a history of fractured left shoulder. I played sport way back when I was young. So I had a lot of injuries. Raise your arms, and it's common, so you guys can read it on your own, on your spare time, and can discuss with our physical therapist here, Margarita. So to improve your leg strength and reduce falls and fractures, so you do your exercises, start close to the chair, and Margarita can teach you this eventually, so I don't have to go over it. But it's there for you to browse. So, medications. I know everybody's, I'll give this to Margarita, a copy of the medication, so they can make copy for you guys, because I forgot to make copies. So, the doctor will say, okay, this is what we're going to do. You have osteoporosis. So I'm going to start you on medication. And all medication have side effects.
Right.
Everything, even the simple Tylenol, simple Advil, everything has. It can affect the kidneys, liver mostly. So always ask. But most decent doctors will weigh their options. They will ask your medical condition. Of course, they should have it, and then the medications that you take on a regular basis, because they have to match the medications that they'll give with your medical conditions, and then your medications. So, what is GERD? GERD is acid reflux or heartburn. So that's basically the same. So the most common medication is the biphosphonates, or they call it diphosphonates. It's help prevent bone loss, and it's kind of like anti-prophylaxis medication. So the common one that you probably will hear is the Fosamax. Remember Fosamax?
Yeah.
Anybody taking any medications here? Good for you. I'm very proud. Avoid it as much as possible. I'm not an advocate of medications. I'm more on prevention. Because the less medications you take, the better you are. So prevention is better than cure. So some medications are your Fosamax. They might start you on 5 milligrams, 10 milligrams, or 35 milligrams, 70 milligrams if it's severe. So you take it once a day, 5 milligrams, or 35 weekly. Some of my patients prefer the 35 milligrams weekly because then they take it once a week rather than every day. You could ask your doctor if you can do that, if they do that. And the Actonel is a weekly or monthly medication. It's also for treatment and prevention. So the 5 milligrams PO daily, or again 35 weekly, or 150 milligrams monthly. So there's a lot of dosage and duration, but it depends on your doctor and your medical condition. Voniva, remember Voniva? You always see it on television. So it's a monthly pill, or you can have it as intravenous. They insert like a needle, and then it's an infusion. And it's very expensive, and it's sometimes your insurance doesn't cover it. So you have to take a look at that. So the other medication is on your slide. I'm just discussing it. But usually you take it 60 minutes before your first food or drink because it can absorb better. Take it with plain water because remember they advise you don't take your medication with orange juice. If you happen to like orange juice, don't take your pills with it because it affects the absorption of the medications. The other medication that they have is you take it once a year, but I think it's $1,500. It's very expensive, and sometimes the insurance doesn't cover it. They call it Reclast or zoledronic acid. It's the same to reduce the incidence of fractures, and you can also take it every 2 years depending on the dose.
But what are the side effects of those things?
We'll go through that. The Sumeta, it's also a 4 milligrams IV infusion, and Aridia, they are more like IV infusion. So the side effects, in general, this medication have side effects, like heartburn or your GERD, stomach discomfort. It irritates your throat also. That's why when I put my patient on certain medication, I tell them to drink water first, drink the medication, and drink another glass of water, just to wash it out. Headache, it can cause headache, just any other medication. Muscle and joint pain. You would think like, why would it cause me muscle and joint pain? But it's only in the very beginning, and after that, your body adapts to it, you won't feel it anymore. And unfortunately for ladies, it causes flatulence. You'll be farting all day long. I promise you it's only in the first 3 days. After that, it disappears. You become gassy. So it's like, I can go out with you. Why? My doctor put me on Fosamax and I've been farting all day. But, you're a good friend of mine, so if you're okay, then I'll go with you. So you have to give them, like, warning. So that's what I tell my patients. Yeah, pre-warned. So difficulty in swallowing, but it goes away again in the very beginning. And some people, like my patients, when they come back to report to me, they'll say, oh, I'm okay. Sometimes you don't have it. So it depends individually how you feel about it. So pain or burning under the ribs or the back. So those are common because they started to act and help build your bones again, so you'll feel it. Jaw pain, numbness, and swelling. But there's a caveat to it. Because women especially, they have different symptoms than men with heart attack. Women can have a back pain, stomach ache. Men, typical, that, arm pain, then it goes to the chest, and then the throat. We are different. One of my patients had a major heart attack. The only symptom she had, left arm pain. That's it. She thought she's big exercises, and I said to her, no, something's wrong. Go to the ER, and true enough, she had a heart attack. Wow. So you gotta be careful with that. Allergic reaction, which is common. So of course, I know none of you are pregnant, so you're okay to take it if you have to. Because if you are pregnant, let me know. I'll get in with the wealth. So those are the common medication, and Prolia is kind of new, and then Ex-Vega. But the same thing, they have the same symptoms like with your peripheral edema, like edema of the legs. And of course, most of this medication also has the tendency to lower your phosphate, so your doctor will probably do your liver function, kidney function test, and calcium and phosphates level. So those are the common. And I made a list for you guys so you can read it. I'll give this to Ate Delia also. So Evista is also one of the new drugs that's coming in. You can take it with or without food. That's why people like it. Other medications that's common are Forteo, but as I've said, it's the same side effects. This medication has the same warning, and there's one medication that you really should ask the doctor if you suffered a heart attack. I can't remember it right now. I think it's Reclass. You should not, he will not give it to you.
Maybe ability.
Yeah, ability. You got it. CC studied. You got A+ today.
I read the packages.
Yes, they can cause heart or cause another heart attack. So, but as I've said, if you have a very decent doctor, they review everything. If your doctor doesn't even know, and you've been going to him for a while and doesn't even know the medications, I think it's time for you to change the doctor. I always tell that to because one of my patients came to me, I said, what medications do you take? And he said, I don't know. He just gave me this bunch of pills. And I said, what do you mean you don't know? So I said, I used to work in the emergency room, so I know how it is. And I said, when you go to the ER, the first thing that they will ask is, what medications do you take? And also get to the habit of listing the medications that is over the counter. If you take Tylenol, Advil, or multivitamins, make a list. Because nowadays some people take a lot of herbal medications and they can have interactions with the medications that your doctor have to give you. So always be in charge of your health. And I said prevention is always a cure. Prevention is better than cure. Remember that. And you guys look vibrant, young. Really, honestly, I'm not bullshitting you. But you all look great. Because, I have taught in Jersey City, majority or half of my patients, and God bless them, they're all in wheelchairs. So you are lucky and consider that a blessings from above. So, and I always say, it's always good to take vitamin G. That's my parting goodbyes. Vitamin G, you know what it is? Anybody can guess? God and gratitude. Always be thankful because someone is always looking after us. And I always know that because I have experienced it myself. When you talk to God, especially in your sad moments, or I'm basically a happy person, but then there's a time that I needed something, and I just walk. We have wonderful trails. I walk, and then I pray to God, I talk to God, and I thank for all the blessings. But, it's a good practice every morning. And for me, this is a blessing that I can serve you through my teaching. So thank you so much for giving me the opportunity. And yes, questions.